very similar types of complex care, and this amounts to 15% or more of a difference between us. Secondly, publicly available data from the federal government, from Medicare in this case, confirms that cost, not price, but cost, of care in our facility for taking care of the sickest of the sick is in fact lower than any of the other major academic medical centers in town. And thirdly, I think we are rightfully proud of being able to do this while providing great care. And this year we received the most prestigious award that we could get from the American Hospital Association, an award given to a single hospital in the entire country for quality of care given. So I think that we're already partially delivering on that promise, but that is only partially. And that is the present, not the future. It is nowhere near enough. All of us have to do more, and we at Beth Israel Deaconess need to do more also. We all need to think differently. We need to restructure ourselves to do an even better job. We at Beth Israel Deaconess have come together, doctors and hospitals, to coordinate care and make sure that the best care is provided to patients wherever they are. Not just in Longwood, not just here, but out in the community. We've set up a structure to align hospitals, doctors, and patients around common themes, better care at a lower cost, and to make sure that we're jointly incentivized to do the right thing. The right care, as opposed to simply more care. What we need to do, in essence, is to put our money where our mouth is. But because I know I've got another minute or so, I want to take the time to answer a question that you didn't ask, which is what could GBIO do to take an active role in helping to ensure affordability and accessibility beyond simply facilitating the discussion? You know, end-of-life care is a critical component of what we do, both in terms of quality of life, but also in terms of cost. It's very difficult for insurers, for providers, to talk about this frequently, since patients, families, and others worry that we are just trying to save money. It would be invaluable if all of you, if faith communities would take a leadership role in statewide discussions about how we can ensure that we are doing better in end-of-life care. That includes, but isn't limited to, helping us ensure that we're spending our money as wisely as possible. So I issue that as a challenge to all of you. In the same way that you ask us what we will do, I think we need to do this together. Thank you.
Thank you very much. The next hospital leader to address GBIO will be Ms. Kate Walsh. Ms. Walsh is the President and Chief Executive Officer of Boston Medical Center. Thank you for being with us tonight. Your organizational specific question is, your hospital is an essential part of the safety net for some of our most vulnerable citizens. Given that so many of your patients are on Medicare and hence reimbursed less for their care, can you tell us how you can continue to be financially viable in the future while continuing to serve this vulnerable population? Thank you.
It's kind of a hard question, but well, thank you, everyone. We're very glad to be here today. I think this is a great event. I'm going to come back. This is fun. So to be very specific to the first question, over the past 3 years, Boston Medical Center has reduced our cost structure by 10%.
Can you speak into the microphone?
Oh, can you hear me now?
Yep.
Okay. Has reduced our cost structure by 10%, which is close, in our case, to about $100 million. And our expense growth has been flat for the last 3 years.